Hello, this is drnutrifetal.com. Have you ever wondered what will happen if blood moves too slowly in your blood vessel? This brings us to today's topic on deep vein thrombosis. If blood moves too slowly in your blood vessel, then the blood cells in your vessel clumps together and form blood clot. And if the clot is formed inside your vein deep in your body, then we call it deep vein thrombosis. If the clot breaks off and travels to your lung vessel, then it can cause a fatal complication called pulmonary embolism. Therefore, it is very important to know about deep vein thrombosis. Deep vein thrombosis especially occurs in your lower extremities and it is more common than in upper extremities. Now let's know about the risk factors of deep vein thrombosis. Age greater than 40 years, obesity, family history of deep vein thrombosis, past history of deep vein thrombosis, if you are under oral contraceptive pills, if you are pregnant or have given birth to a baby recently, and if you are on prolonged bed rest and stays immobile for long, and if you have recently gone major surgeries like orthopedic surgery, pelvic surgery or abdominal surgery, then you are at high risk of developing deep vein thrombosis. Now let's talk about the symptoms of deep vein thrombosis. Swelling of one or both of your legs, pain in the calf region, warm and tender leg, and redness of the leg suggests deep vein thrombosis. So, if you are at risk and develop this symptom, then you should visit doctor as soon as possible. Now let's talk about the diagnostic method of deep vein thrombosis. D-dimer test, phlebography, venous ultrasound, MRI, and CT scan are the diagnostic method of deep vein thrombosis. Now let's talk about treatment method. Your doctor may prescribe you blood thinners which prevents blood clotting, and your doctor may prescribe you compression stocking, inferior vena cava filter, and suggest catheter directed thrombolysis. It's always better to prevent deep vein thrombosis than to get it and treat it later. So let's now talk about preventive measures of deep vein thrombosis. The universal preventive measure for most of the diseases, that is losing weight, exercising regularly, and quitting smoking, also suits deep vein thrombosis. Now other preventive measures are, if you are traveling for longer duration, then don't forget to stand up and move a little bit, and if you are stuck in the seat, then stretch out your legs frequently, and if you are on prolonged bed rest, don't forget to stand up and move a little bit. And if you have undergone major surgeries, your doctor may prescribe you some blood thinners to prevent deep vein thrombosis. And this brings us to the end of today's topic on deep vein thrombosis. Thank you for listening. If you want to know more on deep vein thrombosis, please visit our blog and the link is given in the description below. We'll be back next time with next video. Stay tuned and don't forget to share and subscribe. Have a good day.
drnutrifethealth.com. Your health, our effort.